Thank you for the opportunity to share what I believe to be the future of healthcare. And what better person to come to that decision after having to be an advocate for myself 30 years ago when I was given a terminal diagnosis of ovarian cancer. And unfortunately, by the time they figured out what was going on with me, I was actually too far gone for any standard of care therapies. So likely my story is not that different, maybe just give it a different label of disease process or whatnot, but likely you're interested in hearing about what we're going to talk about the future of healthcare because of your own healthcare journey or that of someone near and dear to you that was met with a condition that standard of care was unable to help. And so with that being said, in the past 30 years, I saved my own butt. That was a pretty big deal. Went to medical school. Actually had my doctorate in oriental medicine as well as my doctorate in naturopathic medicine. I also spent 13 years studying Ayurveda. I've spent unbelievable amounts of time studying with brilliant leaders in conventional oncology, integrative oncology from all over the world, with healers of all kinds of modalities all over the world. And I've come to a few conclusions. I've come to a few things that I've learned along the way. And instead of waiting for someone to create the type of healthcare system I know that we all deserve, got a harebrained idea about 29 years ago that I just need to create it. And so luckily over these years, I've come pretty close to having it come to fruition, but I've brought together or a team of people who have come together to make this happen. And so this discussion is going to talk about four main things. We're going to talk about what is wrong with the current healthcare system. That's kind of the first piece here. So what are current health statistics, both in general, worldwide, United States centric, since that's the ones I know the most, as well as the current statistics in cancer in general. And then number two, we're going to kind of talk about this concept of sort of personal accountability and responsibility, since no one is in essence coming to save you. What model is emerging that can help you start to save yourself and engage and even help transform into a new healthcare system? Number three, we'll be talking about how can you help, whether you want to come in as a practitioner or a patient advocate, or even just self-learning on this process, or maybe you have interest in philanthropic components, or maybe you have some expertise that could lend itself to an advising role or some volunteer roles, or perhaps you even are an investor who is very interested and curious about what we're building in some of our for-profit entities, in addition to our nonprofit residential hospital and research institute with regards to integrative oncology and general care. And then number four, we open up the last of this to just some really juicy discussions, questions and answers from people who listened in live to this discussion, and Linda weighing in from what she sees the current and future role of healthcare to be. So please join me, please tune in, please be a part of this grassroots movement to change the way healthcare is done globally. Thank you so much.